Right, let's start with risk. What are the risks from substances used in motor vehicle repair body shops? This is from HSE's website. It shows the top 10 asthmagens in the UK, top of the pops. And you'll notice that isocyanates are top of the pops. They are the biggest single cause of occupational asthma in the UK, and they have been for years. Now, who using isocyanates are at greatest risk of getting occupational asthma? The answer to that is you and your employees, which is why we're here today. Vehicle paint sprayers as a group are at greatest risk of getting occupational asthma induced by isocyanate. Your risk, the overall risk, is 80 times the average for the working population, which translates into several tens of people per year being invalided out of the industry. About 1 in 10 people who work in motor vehicle repair body shops who get occupational asthma are not sprayers. They're body shop managers, they're people who prepare cars, they do other sorts of work. So there's something going wrong there, and we'll talk about that as the day goes on. All the statistics and information is on HSE's website, which is chock full of stuff. Right, figures are okay. The trouble is that figures, you're bombarded with figures every day, and I must admit, as I get older, I find it more and more confusing that this is a risk, this is not a risk, that's a risk, and so on. It's a very, very confusing picture, and they don't really mean a lot in real terms. So what we've done here is we've interviewed Dr. David Fishwick, who's a senior medical officer for the Health and Safety Laboratory, and he talks about how people get occupational asthma, how it's diagnosed, what happens to your health when you get it, and what health surveillance is for. So we'll play Dr. David Fishwick being interviewed by me about these issues, and then we'll go on to meet somebody who's got occupational asthma. Could you just give me some idea of your job and your experience, please?
Yes, certainly, Mark. I'm a consultant respiratory physician at the Royal Hallamshire Hospital in Sheffield, sort of an industrial heartland of the UK. And I also work as the Chief Medical Officer at the Health and Safety Laboratory, also a reader in medicine at the University of Sheffield, so I've got a rather odd, complicated job. Right. My experience dates from training in medicine in Manchester in the early 80s. I qualified in 85. And since that time, I've always had a major enthusiasm for chest problems or respiratory disease.
So in your experience, do you find that people get missed, as it were? They've been to their GP, he or she has said, well, yes, you seem to have got asthma, and they give them treatment, but it takes some time to get that connection.
We've relatively recently finished a study in the United Kingdom looking at this very point. In other words, if you are a worker working as a spray painter and you get symptoms of wheeze or shortness of breath, you go and see your family doctor. How long does it take a person like that to get to an appropriate hospital specialist? And we looked at about 100 cases of people nationally with possible occupational asthma, and the average was about 2 or 3 years, but there were some stars out at 28 years. Wow. So there are major delays for certain individuals in the system, and of course, if those people are continuing to expose themselves in the work environment, that can be doing much more harm.
Right. And what happens to patients with occupational asthma, in your experience? I mean, you see them sometimes quite late in the day, I guess, and others are picked up earlier in the day when their symptoms are relatively mild. Could you give us some idea of what happens to them?
Well, to give you an example, I saw a case a few months ago of a worker working in a food processing plant who had become so unwell on night shift that he had to be dragged out of the workplace by his colleagues, desperately ill with asthma, never previously been diagnosed, almost died and had to be taken to hospital. It was only about a few months later that the penny dropped that this gent had been working with prawns, and prawn meat itself can cause allergy and asthma. Now, I'm not saying that most people with occupational asthma almost die, but asthma is a serious condition. If people continue to expose themselves, like this gent I've just talked about, it could have caused him fatal or exceedingly severe asthma if it was not picked up. Okay. Thankfully for most people, the situation is a bit clearer. If you continue to expose yourself, you are likely to have troublesome continuing asthma symptoms. If you stop exposure. In other words, you're a spray painter, the diagnosis is made, and you retrain and don't expose yourself to paints. About a third of those individuals, even though they're not now exposing themselves, will get worse. About a third will stay the same, and about a third will improve. So the bottom line is it's a serious problem, and reducing or stopping exposure doesn't always cure people.
Occupational health surveillance. People exposed to asthmagens should be under occupational health surveillance. What's your views on what's good occupational health surveillance? Can you give me an example of where it's worked?
Occupational health surveillance is very important for watching groups of workers who may be exposed to agents that could cause asthma. For those who are unaware about what occupational health surveillance is, it may be a nurse or a doctor seeing each individual within a workforce, for example, a spray painting garage, every year, to ask them a very brief set of questions about their breathing and perhaps also take some measurements of their breathing test. I think good practice for individuals who are exposed to asthmagens in the workplace is to be seen at least yearly. And this could be by a responsible person such as a nurse or a physician. Normally in the workplace this will be a nurse or an occupational health provider. At that meeting, the worker would be allowed to talk about breathing problems, and hopefully in most cases that's going to be very quick because there won't be any. But as you make the point in the question, if there are early beginnings of asthma, it is best to pick it up in that environment rather than wait for acute asthma or bad asthma to occur. I would also think breathing tests are important every year as well for individuals who are exposed to known asthmagens.
You get compensation based on disablement and how that disablement is judged. So, for instance, at the moment it's about £70 a week if you're 50% disabled. What does 50% disabled mean if you're an asthmatic?
Well, asthma's a very variable condition, so we have to take that into account when we're calculating disability. For example, asthma may be very troublesome to a worker on one day, but on another day they may just be absolutely fine. So patients can be very disabled on one day and not disabled at all on another. So my comments relate to a sort of average over a period of time.
Right.
50% disablement would generally imply quite significant shortness of breath. To give you an example, climbing a flight of stairs would be difficult. Walking around a supermarket, even without pushing a trolley, would be difficult. And you wouldn't be able to keep up with people of your own age on level ground when walking. You might even have to stop, even at your own pace, on level ground when walking at that level of disability. So that's quite marked.
It's quite marked, and you're quite disabled by it then?
Absolutely, and of course that's what I am sure why the DSS has drawn a line at that point in terms of disability or in terms of what you're describing in terms of money income, because of the fact that it is really quite marked impact. It has a marked impact on your life.
Okay.
Okay, you heard David Fishwick talking there. The average time from symptoms to diagnosis is between 2 and 3 years, during which time people are still overexposed. But you also heard that sometimes diagnosis can take many years. Continuing exposure causes troublesome symptoms which get worse over time. Stopping exposure doesn't mean you get better. 1/3 of people get worse, 1/3 of people get somewhat better, and 1/3 of people stay the same. So stopping exposure doesn't cure people. David talked about occupational health surveillance, and we're going to cover that in more detail later on. And he also described 50% disablement, and again, the next witness, if you like, describes that in more graphic detail. This is an interview with a guy who's a welder, who's got occupational asthma, called Phil. He is the patient of Dr. Fishwick, and David Fishwick interviews him here.
Perhaps you could start just by telling us how old you are, Phil, and what your occupation was when you developed occupational asthma.
I'm 50 now, and I first developed it about 35-year-old when I first started having symptoms of this.
What was your job when you first started having problems?
Plater welder.
And perhaps you could just explain a little bit about the exposures that you would have had when you were a plater welder.
Exposures we would have had were welding fumes, tremendous amounts of dust, and all sorts of but it was just literally all dust, welding fumes, to an extent where really you couldn't, some days you couldn't see your mate who you were working with without bad, because there was no extraction. It was just there, just hung in air. And you could, if when you open big door to let that was extraction, open big door and it'll let it out, but you could see it glistening. You could see it actually all the time. If you laid your drawing on your bench, after dinner when you come back, it was just thick in dust. So if that were getting that, what were we getting? What were we being exposed to?
So if I'd walked into your workplace dressed like this, I would have got mucky pretty quickly.
Yeah.
What were your employers' thoughts about this? Did they have any knowledge about the fact that they were exposing people to dusts? And did they attempt to do anything about it?
When we first started, we did complain about dust. So he got us a box of rags. Yeah, they could buy. We used to use rags for wiping jobs down with methylene and all.
Yeah.
And his solution were, we used to wrap them round like bandits will, just wear rags around his face, and then his welding helmet. That was it.
So you were never fitted with a more formal face mask or an air-fed helmet, for example, or had any extraction put into the area where you were welding?
No.
Okay. When did you first develop problems with your breathing? How many years had you been working as a welder before you first developed problems?
Well, I started when I was 15. And I first started noticing problems with my breathing when I was about 34, 35. But I hadn't always worked at this particular company. I'd worked at different companies. But at the last company where I got the problems, I worked there for 20 years.
What did you first notice with your breathing?
A tightness. I first noticed it when I just went to bed one night and I woke up and I couldn't breathe. It's just, and I had never experienced that because I'd always played football. I was always fit, and I never smoked in my life. I never experienced not being able to breathe, and it got me down because it's just an awful feeling. You feel as though you're drowning.
Yeah, it must be very frightening.
And it is. And I noticed this, and I had it for. I just had it for about a week before I decided to go to the doctors with it.
Right, so you went to your family doctor
I went
first
to
of
my
all.
GP.
What happened to you after the diagnosis was made? You had to stop working, didn't you?
When it was first diagnosed, when I was actually told, but it was occupational asthma, he did say, finish with welding. But he said to me, finish with stainless steel welding. It's stainless steel what's causing you this problem. So I just went and got a job welding mild steel.
When did you give up completely welding?
Because when did he give up? 1992.
So what were the reasons that made you carry on welding even though you knew it may be harming yourself?
Desperation. I needed a job.
Yeah.
I had 2 young children and a wife.
Yeah.
And I needed a job and I needed a living, and nobody could answer me. And I was only a young man.
Yeah.
I was only in my 30s, and I thought, I just can't not work. It's just, I worked all my life. I worked 7 days a week, and when somebody turns around to you and says, no more work, that's it. It's devastating, and I just couldn't accept it, and I wouldn't accept it.
Yeah.
And I carried on, and I got another job. But it was really getting to a stage where I was having 4 and 5 inhalers a month. And then it started, then doctors started to think, there's something wrong with you. There's something really wrong. You shouldn't be having this. And that's how it was actually the DHSS doctor at industrial disease what finally told me.
So I presume you stopped working pretty much around that time.
Yeah.
What did happen to your breathing over the months and years after you stopped being a welder?
Well, when I was when I was away from it, I felt better. I did feel better when I was away, but I'd been at it for that long. The damage was too far. I damaged myself because I carried on. But I did feel a lot better. But it never went away then. It was just with me all the time.
So what do you like now, Phil? What could you do on the flat, for example, in terms of walking?
50 yard.
Okay.
50 yard, and then I have to use my inhaler.
And what about a flight of stairs?
Oh no. Well, I can. Or any incline. Very difficult now. It seems to have gradually got worse as I've got older, and life's difficult. Very difficult now.
Could you kick a football around in the park?
No, I couldn't, and I missed all. I could never run around with my two daughters in park when I'd got it.
So what you're saying is it actually quite dramatically affected your family life?
Yeah, it did. Affected my family life, my social life, me financially. It not saying it ruined me, but it set me back a lot, you know. Luckily, my wife took a part-time job, and that helped us to go. And very fortunate, my own doctor told me to claim certain benefits, which I didn't want to claim.
Yeah.
Disability, living allowance, I won't claim it. And he had my wife, he phoned my wife up and I'd heard him. And he told her he must claim this is what it's for. But I didn't want to claim it.
I've pretty much finished my questions, but are there any other thoughts that you've got yourself that you'd like to tell us about that have cropped up?
I think the compensation system for people with industrial disease is awful, it's terrible. I think they make people jump through hoops, and it takes far too long. And when I actually got to the stage where I got to the doors at Manchester High Court, and they settled it, and they admitted it. And then the judge said, even though they'd admitted it, the judge said Mr. Hyde should never have had to wait 6 years for this. You knew. So they kept us going, kept me going. They were hoping, like they do with a lot of people in my position, you're going to die. That's what they're hoping, really. I'm going to die before I get my money. And the other thing is the benefit system is awful. It don't treat people with dignity. You know, I ended up like this, not through, I didn't want to go to work. I ended up through going to work, not because I didn't want to go to work. And I just think the benefit system for these people is absolutely awful. And I think people ought to be made to realise what you have to do to get certain benefits and how it ruins your life.
You must feel fairly angry and aggrieved, however, that a young man is placed in a position of being very short of breath, even at rest, from
Bitter.
workplace exposures.
Very bitter, but I can't carry on being bitter all my life.
Yeah.
It's happened to me, and I have to accept it, and I have to get on with my life, whatever life I've got left. I have to just accept it. It's no good me going through life banging the drum and being bitter with everybody. I got it. I'm bitter, but I've got it when it could have been avoided. That's what makes you bitter. And I'm bitter, but people made me go through all different hoops, see different doctors, and they all come to the same conclusion. I'm bitter about that. But you just have to get on with your life. There's nothing else I can do.
Okay, thank you.
Okay, Phil was a plater welder exposed to fume and dust. He first noticed chest tightness some years after first exposure, and he describes it as feeling like drowning, and that's a classic example. It's difficult to make the connection between something which has no effect on you initially. You may work for months, even years, before anything happens, and there's often a gap. You're exposed to work, you go home, you feel a bit rough late at night, early in the morning. You don't make the connection between exposure at work and your condition. His diagnosis was that he got occupational asthma caused by stainless steel welding. And as I said earlier, an asthmagen is an asthmagen. The fact that it's stainless steel welding is irrelevant. It could have been isocyanate in 2-pack paints. He gave up work, but not straight away, aged 38. Why did he soldier on? Because he needed a job, he had a young family, and he was a young man. And young men and women, if we're honest, think that they're immortal and nothing will touch them. So, you know, a bit of paint spray, a bit of welding fume, that can't touch me. The effects on his health, as you've heard, were drastic. He describes the compensation system as awful. Key points from both interviews: asthmagens take time to cause their effects, so you may notice absolutely nothing initially. People often don't realise that they're working with asthmagens at work. The diagnosis of occupational asthma can take years. Meantime, exposure continues. And there's a problem here. The longer you're exposed after you've started to react, the worse the effects, ultimate effects on your health. So the longer you soldier on, the worse you'll get. There's no cure for occupational asthma. So there's only two main options. You either leave your job or trade and work somewhere else not exposed to that asthmagen, or you don't get occupational asthma. Phil's most telling point, I thought, was, I'm bitter that I've got it when it could have been avoided. The rest of this event is all about how not to get occupational asthma, and we believe it's completely possible. There's absolutely no reason why anybody in motor vehicle repair body shops should get occupational asthma. The key issue is what's causing it. It's isocyanate in 2-pack paints. The solution is to control the exposure, and we believe it can be done. And we're going to show you how. First of all, how are you exposed to isocyanates in MVR body shops, and what causes the main exposure? The first thing to say is that you're exposed to isocyanates in 2-pack paints by breathing in airborne fine paint spray mist. There's a lot of mythologies in the industry. I'm not quite sure where they've come from, but they're certainly very strong. People talk about it going through the skin, especially the thin skin around the eyes and so on. It's complete hokum. The dominant route of entry is via inhalation of fine mist. But there's a problem here. Fine paint spray mist is not visible under normal lighting. Here we have a paint sprayer spraying a car, and what we're going to do is show you that fine paint mist. And what we've done is put this black curtain against the side of the booth. We put some bright lights behind the car, and we're going to show you the fine paint mist. So what you see is this spray fan here and some mist going through the floor. That's what you see. That's actually what's present if you use the bright Tyndall lighting, it's called. And basically you're enveloped in a fine paint spray mist that you can't see, smell or touch almost from the moment you start spraying. So it's a case of now you see it and now you don't. Now you see it and now you don't. So the first thing to remember is that you don't see the mist to which you're exposed. It spreads throughout the booth or the room you're spraying in like smoke. You also need to know what you're working with and what causes